So I believe everybody's seeing my screen at the moment. I will. Is everybody ready with their speakers? Okie dokie. So let's get started. Well, first and foremost, I do want to thank you all to take a few minutes of your time. I know it's not easy, especially at this time of day or night, anyway. Um, and to share it with us and to give us a moment of your day to learn a little bit more about this and to allow me to take you through what Fistula Day is, what the protocol is, the design of the study, the structure of the study itself, and so on and so on. So, on behalf of Dr. Humberto Arenas, whom is the leader of the intestinal failure unit and also the leader of um, the protocol, the principal investigator of the protocol, I do want to thank you for your interest in doing something different, your intention to contribute from where you are. I know we have a lot of people in Brazil, especially um, in recent days. We have been having a response from Brazil, which is extraordinary. Um, Unfortunately, Dr. Humberto Arenas will not be able to come with us. He is at the hospital with some patient commitments from his clinical practice. So I will be speaking to you. Let me introduce myself. My name is Dr. Miguel Mendoza. I am a medical doctor. I graduated from Universidad Autónoma de Aguascalientes and here in Mexico, and I am a member of this broad team that conforms the intestinal failure unit here in Guadalajara, Mexico, and really proud of it. We are a team that is led by Dr. Humberto, as I mentioned. Many of you know him. He is a surgeon, but for those of you who don't, he is a surgeon that has been practicing over 40 years of professional practice, and over the past 22 years, Dr. Humberto has recorded and documented over 270 cases of intestinal failure um, and postoperative leaks and fistulas from the GI tract. Um, and by that, I mean diagnoses, I mean management, complications, mortality, and being able to share this with you has been one of his main motivations and the team's motivation to embark on this great adventure that today we call Fistula Day. This is a picture of our institution here, local institution in which we practice. Um, Let me emphasize, I am one of the coordinators of the project, one of many. We have been working thoroughly. Many people have for the past few months, and we are very glad that this is coming along. We are just around the corner from May 8th and very excited. And over the next 30 minutes, we're going to speak uh, on regards of what is Fistula Day, what is the protocol itself, the design, and why we decided to design and launch this project. What am I going to get from it if I am a registered participant? How can I participate and how to answer the survey, so on and so on. Um, and first, I do want to speak to you about the problem, the huge problem that is the prevalence of the fistulas and the GI leaks, the postoperative, post-anastomotic leaks of the GI tract, continue to be, to this day, a huge problematic, which is alarming. Uh, Staggering mortality rates to the roof, severe complications, prolonged hospital stays, and not to mention the cost that this generates um, for the personal budget and for a government budget, which most definitely hurts. Numbers do not lie. And if we take a look on the most recent medical literature, we see that the mortality rates continue to be and will continue to be, um, you know, implacable. They don't lie. The variability, um, the substantial variability of the diagnosis, as well as the surgical and nutritional management regarding this patient, continue to be scary. so to say, to this day, and they're still lacking a lot. I mean, there is a total absence of effective standardization implemented worldwide. You know, and by this I want to include diagnosis and management. You know, and as you know, and I know that many of you do, many of you might have even participated on this work. But Aspen and Penlampe, in recent years, they've collaborated, and they tried to cluster the fistulas, and they edited a document where they classified them in two groups. One that where there is an output and discharge greater than 500 milliliters, and the other one which is less than 500 milliliters. However, unfortunately, and I do want to say it from the bottom of my heart, unfortunately, this is not implemented worldwide. Um, and I guess, and no, I beg your pardon, not guess. I know that this is, the roots for this problematic. Um, and So here's just a couple of charts of the numbers that we've been mentioning for the past couple of minutes. The recent studies that have been published, and if you see the variabilities and the similarities of the mortality rates and the flaws in the methods from the studies that have been published, I mean, it's something to discuss further on. For example, here I'm quoting a Mexican, Argentinian, and Netherlandish study that I'm not going to mention very specifically due to time, which is very short. But if we can discuss it at the end. Um, and this is quite a good picture. I really enjoy the portrait. It's called "The Blind Leading the Blind." Um, Ironically, it is from a Netherlandish author, which depicts a bunch of people following somebody who does not know where he is going, and I find it peculiar and very applicable on this situation, this scenario. Um, so this is the title. If you like it, then you can go ahead and Google it. You're gonna find it right away. Um, let's get into the study per se. Over the last few months, and with very important suggestions by numerous experts on this subject, we designed Fistula Day, which the official title is The Current Status of the Postoperative Fistula in the GI Tract, a multicentric, multinational study, which is as the you know it's an observational, purely observational, cross-sectional study, cohort study, and the title is very self-explanatory. Um, we are not going to intervene. We're not going to make any suggestions on the regarding the managing surgically or nutritionally or in any way to the treating physician or the treating medical team. This study was designed and it was planned for three cohorts. The first cohort, as you can see here on the slide, was established and was agreed to be on May 8th. May 8th is the famous and so-called Fistula Day. We will have a 24-hour time frame for people and participants around the world to report the patient or the patients if they were to have more than one, which is really important because we've had that question on several repeated occasions. People have been asking, hey, what if I have more than one? Well, that'd be awesome for the study, of course. The more numbers and the more reports that we have, the better analysis that we're going to make, and the more robust it will be. So scientifically, the more the better. Um, As you can see here on the slide, it is a multinational, multicentric study. This is not updated. So right now for Mexico, we have over 85 sites registered and ready to participate on May 8th. And in Latin America, we have over 85 sites as well. As I was telling you, and let me congratulate you. I know that we have a couple of people from Brazil, Dr. Antonio Campos, Cristina. Um, we have been having a great response from Brazilians this past few days. A few people have been registered and they've reached out to us and very excited. Some of them have been having a problem with the ethics committee. Um, Hopefully, we will get answered by the end of this week. And if not, we'll figure it out. I'm pretty sure. But I do want to thank you. I do want to thank all the active participation and the concern to be a part of this adventure. Um, Let me go back and rewind it a little bit. We were talking about the three cohorts. The second cohort will be 30 days later, which will be only a follow up. No more patients will be registered on the database. So it will only be the patients that were registered and reported on the 8th. Let's say, for example, if we have 58 patients reported from the total 180 centers that were registered to participate, only 58 patients will be reported and will be followed up on the on the on the next cohort. And lastly, we will have a 60-day follow-up. It's a 2-month follow-up. It's quite easy. You can check it out. Check it out in the website if you want to get familiar with the cohorts beforehand. They are available here at the website down here at an option where it says surveys. Um, Dr. Cristina Gonzalez in Brazil um, she did us a huge favor. She translated them into Portuguese. So if you feel more comfortable in Portuguese, you are welcome to download them from there. So that's great. And as I was mentioning, unfortunately, we do not have a Portuguese speaking member of our team at the moment. So I apologize for that. So just try to hang in there and bear with me. Due to its multinational, multicentric um, nature, we are not, and also the observational nature, we're not subject to any regulation agency such as the FDA, or in the case of Mexico, the COFEPRIS, or what you call it, the is la Secretaría de Salud, which is the name in Spanish for the health department. We are not subject to regulation, although we do have to have, as the coordinating and the leading research site, we are obligated, we are mandated to have the ethics committee approval from our own local institution, and that is something, that is a document that you can consult at our website, and you are welcome to. I do invite you, and I do want to make emphasis that you go ahead and check it out. We also have to have a registration to consider us to be a serious study at the clinical trial before the National Health Institute, and a certification of the good clinical practice um, in order to do biomedical research. And all that I just mentioned, you can consult and you can, you know, calmly read on your own time. If you go to fistuladay.org, you can see the good clinical practice and the certification by Dr. Alejandra Cacho, which is one of our coordinators as well. And you can also look at the NIH certification. NIH, I'm sorry. All right, moving on. Uh, I haven't asked, is there any questions so far regarding the design, the registration, the certification of the study? Okay, so if there's no questions at the moment, we are going to move on. Um, but feel free to stop me at any point. If you give me just 1 second. If we go back a little bit, I do want to make emphasis on the cohorts. This will take you 30 minutes at most, especially the one on May 8th. It is the one that is longest, and it's not really that long actually. It's something that you can do easily on morning rounds. Maybe if you have residents, they can help you out, interns and whatnot. However, it is something that I encourage you to have the file available because we do have some laboratory questions such as the latest albumin value that was obtained previous to the surgery and whatnot. So moving on, who coordinates this study? Who um, the organisms and the medical personalities that support the study and that have been supporting the study ever since it was just an idea, and then the design of the study and the structure of the study. Well, as I mentioned, this study, or if I hadn't mentioned before, um, this is a study. Study. This is a study that has been exclusively coordinated by the editorial committee that belongs to the intestinal failure unit here in Guadalajara. However, and a very important mention, it is a study that has had no financing, no financial aid at all, no financial aid by any government agency or any private initiative. So, which is positive because if you think about it, I mean, we are very free to report the information as we see it and not have to do any adjustment or whatnot to not affect a certain pharmaceutical agency or whatnot. However, even though we haven't had any financial aid, we have had a lot of support, especially by Felampe, which I do want to mention and I do want to call out and say thank you. We have been receiving a lot of support. As you know, Dr. Humberto is also currently the chairman by for Felampe, and we are very appreciative of the organization, and we're hoping that um, you know we will have results and we will have a robust number of reports so that we have a quality analysis further on. Also, the Colegio Mexicano de Nutrición Clínica y Terapia Nutricional, um, recently we have also been getting a lot of support, and we had training the from our to our coordinators from the Clinical Evaluation Research Unit in Canada, um, an organism which is led by Dr. Darren Hayland. You may recall him as well, and they have been very supportive. Rough, you know, pointing out the rough edges. So, in regarding the managing of the protocol, but however, I do want to mention again, this is a study that has been exclusively managed by the editorial committee of the intestinal failure unit. Um, if you want to check it out, if this is something that will interest you, we have the steering committee. You can look at it, the important personalities around Latin America and around Mexico, like Dr. Arturo Vergara, Dr. Manuel Cadena, Antonio Campos, definitely Humberto Arenas, Roberto Anaya, so on and so on, who have been very supportive of the research protocol, and that they recently got together some of these personalities on Aspen Congress on Las Vegas this past few months, which was the last time that this protocol was modified, and which brings us as where we are to where we are today. Now, you may ask, and rightfully ask, is this study legal? What regulatory organs um, are looking at it, looking into this, and under what standards of quality are we designing all this movement? What about the ethical committee and the good clinical practice certifications? Um, we already mentioned this, but before I move on, I do want to mention again, you can consult and you can look at this information, all of it in our website. Um, you're going to find very useful, and you can most definitely contact us if you have any questions regarding that. So, who's participating? We looked at that. As of today, I believe we have over 200 centers, 200 sites that are participating worldwide. We'll have to look into it again. We have been working 24/7, all the coordinators and all the people involved in this, because May 8th, it's around the corner. Now, you may ask, why do I want to participate? What am I going to obtain if I participate and if I report my patients? Unfortunately, uh, since it's a study that has no financial aid, no money whatsoever, not even the people that have, not even us, the people have been working 24/7 for quite a few months, have been getting or making any money from this. So we do not have that possibility to offer you, to offer you monetary benefits for including your participation in this. However, this will be, um, if we have success on May 8th and the following cohorts, one of the most important Latin American initiatives um, regarding this subject, and it'll definitely be important. And what we can, or what we are offering, is most definitely you're mentioning your name as a collaborator on future medical and scientific publications, and mentions your name on the different forums around the world once this is finalized and and a concrete analysis. Uh, do you have any questions at this point? Do you have any doubts or any comments that you want to point out? I have not been looking at the chat, so I have not been. Okay, I see that we have not. Let me ask. Okay, so feel free to let me know if you have any questions. I'll stop at any time. How do I register? Most definitely, I think that everybody that is participating here in the webinar has been registered. However, it's very easy. And you do have to keep in mind that registration will be closed on Sunday, Sunday, May 6th. So if you know anybody that might want to participate, you still have a little time, and you can go ahead and register yourself on fistuladay.org, and we'll most definitely welcome your participation. Now, moving on and going to the last part and the most interesting part, what will my participation consist of? Well, you do not, because that is something that our registered participants have been concerned. They are telling us things like, "Oh, I have no time. I'm very busy," and we understand most people are. However, the good news is that answering this survey will only take you a couple of minutes, or not a couple of minutes, but it will take you 15, 20 minutes at most. And I will show you. I want to show you step by step, really fast, how you're gonna do it. So that everybody is on the same page. What you're going to do and what you're going to see happen coming May 8th will be a link such as the one I'm going to show you at the moment. You're not going to see this interface. This is only for the organizing committee, which is us. The only thing you will receive is a link that I'm going to show you. If you give me just 1 minute. And I will show you how it's going to be from the moment that you get the invitation to how you're going to answer the questionnaire. So coming May 8th, what you're going to do, and you're going to go ahead and go to your inbox at the email that you registered when you registered to participate on the protocol, and you will receive an email like the one I'm going to show you just in 1 minute. Okay, so it's going to be something like this. Obviously, you will receive the email from a domain that will look more like this than like this. However, due to the time that it's very limited, I am sending you like this. You're going to open the email and you're going to have a link such as this with a legend that goes a little bit like this. Like it says, please take the survey. You may open the survey in your web browser by clicking on the link below. So all you have to do is click on this link, which will direct you to the page. I'm having a little bit of technical problems, but May 8th, you won't have this problem. The only thing you're gonna have to do is open the link, and because of the time, I will show you like this. It'll take you to an interface that looks exactly like this. In fact, this is the survey, the actual survey that will be answered. It says facilitate first protocol, and please complete the survey below. Do not leave any questions blank. That is very important. Um, as you can see, there's a legend and a little sign that says must provide the value. Most of the questions have this, and if you don't answer, it's not going to let you submit your questions, your answers. So you got to be careful with that. So it's the country. For example, you will say Mexico. In my case, just click here yes, the for it to correct on its own. For my case, would be Guadalajara, and then we enter. The cohort is made up by 3 blocks, which the first one being the site demographics. So the characteristics and the specifications of your institution or the hospital that you're going to be reporting patients from. In this case, is Hospital San Javier. The level of my institution is a high specialty center. We get about 3 to 4 patients on average a month. My hospital definitely has an intensive care unit. We definitely have a multidisciplinary clinical nutrition team, which is the intestinal failure unit. I believe it has in a range between 201 and 300 beds. Definitely. Does it have an intestinal failure unit? Yes, we do. That is us in our case. In your case, obviously, the reason I'm taking you through this is that you don't have any doubts, and that if you were to have any doubts, you just go ahead and let me know. Um, in case you are the treating physician, how much experience do you consider to have? So, in our case, I believe we are experts, um, and then we enter to the second and middle block, patient specifications. It will not provide you, it will not ask you for any potentially identifiable information. So that's one less thing to worry about. So, but it will ask you for the sex. In this case, it's a male. I do want to take you very thoroughly through this part because we don't have a link or a way to link all the answers. We are asking you to give a patient report number by institution. Since we're not allowed to ask you for the record ID that the official record ID that the institution gives you or give as a patient when you're admitted. We are asking you to provide a patient report number given by you as the research coordinator at the specific site. For example, we have an example that is very graphic here. If I am the attending surgeon for the Texas General Hospital and I have a total number of patients that I want to report, it's two patients. Okay, I'm entering two patients on May 8th. What I want to do here at this space is I want to give a name or a number for patient one and patient two, and this will be the easiest. Um, we do not want you to get confused because this will be your responsibility coming the second and the third cohort. So I highly encourage you to just go easy and say patient one, patient two, three, four, five, if you were to have more than that, and so on. So we have a legend here to remind you. If you have a question, just please let me know at the end of the webinar. We are going to ask for the age. Let's say he's 55. The duration of the hospital stay. Well, he stayed over a month, which falls under this category. The diagnosis. Our principal diagnosis is enterocutaneous fistula. Now, regarding the additional diagnoses, and what's the difference between comorbidities? Comorbidities might be a chronic state. Let's say the patient has diabetes, but he is not suffering from any complications such as ketoacidosis or any uncompensation at the moment, but he has an infection, so to say, for the catheter or the central line. You will be asked to Christina. There is no standardized for primary diagnosis. We do ask you though. I mean, if the patient meets the criteria, he will either have a fistula or he will have a leak. So that is what we're looking for. In case that has not been defined, then you just have to go with the most probable diagnosis. But we don't have a list for you to choose from. I don't know if I'm being clear. Okay. So so I hope this was clear. If not, let me know and I'll go back to it. In comorbidities, we are going to report if he doesn't have any, um, or then you just don't choose any of the options, or you put other. Does the patient have previous bariatric surgery? Yes or no? In this case, no. Does this patient smoke or use tobacco? He smokes. He's not receiving steroids. He has not been treated with radiotherapy in the abdominal area, and the location of the fistula in this case, let's say, is proximal small intestine. Um, Also, we have had a couple of questions regarding the diagnosis or the event which the fistula occurred in. We had a question where they asked us, okay, let's say my patient has been obstructed with, and he has intestinal obstruction, and he ends up in the ER, and ultimately ends up being intervened due to the obstruction. Well, we ask you if you can be as specific as you can, then do so. If he was on the ER because of the intestinal obstruction, then that is the option that you will have to choose. However, you can or you may choose more than one option, and you can see here we have the legend that clears that up. Clears that up. So let's say for that case in specific, you would click here, and then you would click on the emergency surgery option. That is a great question, Christina. The location of the fistula is unknown. I'm going to have to get back to you with that, because that is yeah. So at the end of the webinar, I'm gonna get in touch with you and let you know. I don't have the answer right now, so that's the reason. Um, so moving on, was the patient managed with the open abdomen technique? Yes or no? And this is one of the first questions where we're going to have the logics applied. If you click yes, we're going to have a couple more questions displayed. If you don't, then there's no reason. So that will make your life a whole lot easier and save you a bunch of time. So let's say he wasn't managed with open abdomen. Um, there was repair from the anastomosis. The type of the reparation was mechanical reparation. Um, was there any intestinal discharge from the anastomosis or tissue repair? Um, let's say he had peritonitis, so we have three options here to choose from. There were clinical manifestations. We did use a CT scan to localize and corroborate the diagnosis. He was surgically intervened on an early manner. And by early manner, we do mean first 7 days. Okay, so we did get asked, so we added an option here that said first 7 days. Did the fistula appear after draining an abscess? Yes, it did. Or you can say no, it's just a yes or no question. And as you can see, it'll display more options in case you choose yes. Is it an enteroosmospheric fistula? As you can remember, our patient has an enterocutaneous, so in this case, no. One more question. Okay, thank you, Dr. Cacho. So that has been cleared. How much output was the drainage of the fistula on the day previous to the survey? So we are taking the values given by Aspen-Felampe guidelines. So greater than 500 or less than 500 milliliters, or it was not quantified, if that were the case. What was the patient's C-reactive protein value? If requested, you are going to have a range to choose from. So that will make our life a whole lot easier when the analysis time comes. Let's say it was this, and coming this part, it is important. I know that in most Latin American countries, we do use centimeters and we don't use feet or inches. So I guess we're not going to have that problem. But it is important that you report it on centimeters. Let's say the patient is 1.80 meters, such as this. You're not going to answer this because it's going to make an automatic calculation. And if you don't provide the valid value, it's not going to allow you. And obviously, you will not allow to submit the answers. So just keep in mind, you will have to report it like this: 180. Let's say the patient was 80 kilos. and it'll give you an automatic BMI. Okay, so it's very important. Um, we're going to measure the circumference of the patient's gastrocnemius. We have a variety of ranges, so you choose the one it falls under. The patient is being managed by oral route or not, meaning is the patient being fed by the mouth, or the patient's not being fed. Let's say he's not. If you choose the other option, you will get displayed. You will get a couple more questions displayed. So, for example, under which category does it fall under? If the patient is being managed like this and has decreased food intake. If he does not, then you just say no. If he does, you have, I think, 3 more questions. So as you can see, it's quite easy and quite self-explanatory. Um, but I am very glad that I have a chance to explain this to you in English. Does the patient have any chronic gastrointestinal malabsorption? Let's say no. He has experienced weight loss, which was 10 to 15% of his total body mass on a period of 1 month. I do follow clinical guidelines. In this case, I follow the Aspen Felampe. You may choose any of this displaying. If you don't, let's say you have your own management, then you just go ahead and click other or none of them above, which will ask you, do you have your own management? Let's say yes, because somebody at during my residency taught me how to. This was the appropriate way to manage such patients, which is part of the problem and part of, or the one of the most vast motivations for the launching of this study, the absence of standardization. We don't have something like the Glasgow scale to give us a very clear panorama on where we're standing and where to go. So this is quite a very important question. So please take your time to review this and answer accordingly. Is the patient in total fasting? Let's say he is. So the patient's albumin value at the moment it's 1.122. He's being fed with parenteral nutrition, which was an individualized bag, and he was not treated with glutamine. The patient's caloric intake was 15 to 20. And this is, as I said, very self-explanatory. Did you apply the therapeutic test using 48-hour octreotide or a somatostatin analog? Yes or no? He did go to surgery to repair the fistula, and it'll display this question, the preoperative albumin. So that's what I was mentioning on the file, and keeping your file available. Because you might not remember the albumin. So, and we do want to keep the data reported as accurate as possible. So, something to remember coming May 8th. I did not place any enteral access during the surgery, and the cavity did not drain. The patient did not, or let's say he did, and we used a Whitman patch. The intake means the total. If you are providing several routes, you have to report the total. And lastly, was the patient admitted to the ICU during this hospital, his or her in hospital stay? Let's say he was, and you get 2 more questions. He was there for 15 days, and he did not require the mechanical. So after you're done, you have 2 options. You can either save and return later to if you want to review your questions and your answers one more time, you have that option. As long as it's on as it is on the 24-hour time frame, you're not going to be allowed to send them. The system will not allow us to receive any more reports after May 8th. So as long as it's on the 24-hour time frame, you may return later and you may save your answers, and we'll give you your previous answers so you don't have to start from scratch. If you're done, then you're just going to have to click submit. And if your questions are all accurate, then it'll give you something like this. Thank you for being a part of Fistula Day. Also, you can download your responses. Have a great day. If you were to have another patient, the only thing that you have to do is go back to your original email that you got your link, click on the link again, and it'll take you to the survey again. Again, I'm showing you like this because I had a little technical problems here, but I will solve it. Uh, I just do want you to know that if you have more than one patient, the process is the same. You're going to have to go back to your email and click on the link given below, which will take you to a blank sheet of answers, and it'll allow you to answer the survey once more. So that's that. I want to show you the contact information for the coordinators. If you want to contact Dr. Humberto Arenas personally, you are most definitely welcome to shoot him an email. You can call him up. So this is the phone number. You can call Dr. Alejandra Cacho, which is also one of the coordinators of the project. This is her information. You can most definitely shoot her an email or give her a call. As I told you, we are working 24/7, so we want to hear you. We want to hear all your doubts, and we prefer to hear your doubts. And let's be on the same page for May 8th. And also, and definitely, you can call me and shoot me an email. I'm Dr. Miguel Mendoza, and I'll be happy to assist you. Or you can contact Tania Covarrubias, which is the certified dietitian or one of the certified dietitians from our team. You can contact Dr. Juan Francisco Garcia, which is one of the treating physicians in the research and the intestinal failure unit, or Dr. Jorge Luis Garnica. We are coming to an end, so at this point, I don't know if there was anything that you want to be covered, anything that I did not cover, or any questions that you want to dig in deeper. Um, our website is very friendly, so we have everything out there in the open. You can just go ahead and consult it anytime. Um, the menu option, we have the home, about, the participants, the registration, the committees, and the contacts. If there were to be any information that I did not cover, or that the website does not cover, just we have the you have the contact information. Let us know. As I said, I want to hear you. I prefer to to answer your doubts. I'm available 24/7. So that be that. Is there any questions at this time? Was everything clear regarding the design, the structure, the certification, or the actual dynamic that's going to take place on May 8th? I'd like to hear you. No questions, no comments, no feedback. So we're on the same page. Okay. Um, if there's no further questions, then I guess we're gonna call it a wrap. Um, Again, I want to thank you. I want to thank especially the people, our friends from Brazil, Dr. Campos, Dr. Christina. Thank you very much for your participations. We have spoken on the phone um, a few times, and I'm very happy to see participation from non-Spanish speaker countries, and it's very rewarding to have you here and have you participate, have you ask questions, and most definitely have you giving us feedback continuously. I know that you've been doing this for quite some time. Also, I do want to hear about the ethics committee issue. If you have more further information later on this week, I'll be available, and we will be talking via email or via phone. So one more chance. There's no more questions. If there's no more questions, then we're going to call it a night. Again, thank you on behalf of Dr. Humberto Arenas Marquez and on behalf of the integrated practice on intestinal failure. I want to thank you for sharing your time and giving us a space to communicate and to take you step by step on what Fistula Day is, and the dynamic on the 8th. Thank you very much. And we are looking forward. We are very excited and very enthusiastic to succeeding on this project. Very proud to be the first study of its kind from a Native Latin American initiative, and you know. So thank you very much. Have a good day. Have a good night.